Okay, Bismillah ar-Rahman ar-Rahim. Good morning, everyone. My name is Zahraa Haidar, and I'm a final year medical student at Sharjah University. I would like to express my thanks to the scientific committee for giving us the opportunity to present our work in front of, I must say, the masterminds of internal medicine, and to listen to your constructive feedback on our work. I would also like to give a special thanks to Dr. Tawsif for supervising me on this project and guiding me through it. In my abstract, I will present a case report on isolated ulnar artery occlusion in a case of severe iron deficiency anemia. By the end of this presentation, I aim to highlight the association between severe iron deficiency anemia, reactive thrombocytosis, and thrombotic events in an otherwise young and healthy woman. To present our case in this report, it is a case of a 41-year-old woman who presented to the emergency department with a bluish discoloration of her index and middle finger as depicted in the image. And she also had, the discoloration was for 2 days with no pain in the area, and there was normal movement in her hand. Along with this discoloration, she also had a history of 2 weeks of headache and dizziness and blurring of her vision. Otherwise, she does not have any other long-lasting illnesses, except from menorrhagia and uterine fibroids, and she's also a heavy smoker for the past 10 years. On examination, we saw that there was a bluish discoloration in her right hand, in the middle and index finger of the right hand, along with the medial side of the palm, and there was a delayed capillary refill of more than 3 seconds. And she also had, however, the pulses were palpable and they were detectable by Doppler. On initial investigations, we saw that she had a hemoglobin level of 6.7, and the platelet count was mildly elevated. Her blood smear showed that she also had microcytic hypochromic anemia, for which she received 1 unit of packed RBCs along with IV iron therapy. She was referred to rheumatology for follow-up as we suspected Raynaud's phenomenon for the symptoms that she experienced in her hand. She was also discharged on oral iron supplements. Rheumatology workup for thrombophilia or any autoimmune panel was all negative, including anti-ANA, anti-cardiolipin, and other investigations. It did not show any significant results. Therefore, she was referred for vascular surgery for further follow-up. However, before she could manage attend her follow-up, she presented again to the emergency department, this time with severe pain in the area, and she was beginning to lose sensation at the tip of her fingers. And on examination, we also saw that the ulnar pulse was now not palpable. However, the radial pulse was still palpable, and on Doppler, we could see triphasic signals in the radial artery. However, the ulnar artery only showed monophasic signals, and there was no supply in the deep palmar arches. Therefore, she went for an urgent CT angio, which showed a complete occlusion of the right ulnar artery from its origin up to the wrist. And there was also partial occlusion of the radial artery, and there was a filling defect in the internal jugular artery at the level of C2 to C3. Therefore, she was transferred to vascular surgery, where she went for an open embolectomy of her thrombus in the ulnar and radial arteries. As you can see here, the extracted thrombus. And she was started on antithrombotic therapy. On follow-up, following the surgery, the discoloration was resolved. However, she still had slight numbness at the tip of the fingers, and her lab results were normalized. However, the platelet count was still significantly mildly elevated, as I can say, on the upper higher limits. So in the conclusion of our report, we can see that severe iron deficiency anemia causes a prothrombotic state in the patient due to the reactive thrombocytosis. And although some case reports show that some venous thrombotic events do happen, such as in the cerebral veins or in the jugular veins, it is extremely rare to find an isolated occlusion in an ulnar artery or in any artery. which drove us to present this case to you and to increase the index of suspicion of thrombosis in such cases of severe iron deficiency anemia where other risk factors are absent or any other trauma to the area are not present. So thank you for listening.
Thank you so much, Dr.